Hi, my name is Angela Pelosi. I'm the Global Director of Audiology at Phonak, and I'm here today with Professor Anne Marie Tharpe, Chair of the Department at Vanderbilt University Medical Center.
I'm so pleased to be here with you today, Angela.
Thanks so much for joining Dr. Tharpe to share further updates on the topic of children and unilateral hearing loss. Anne-Marie, perhaps the most valuable resource an audiologist would be able to have would be a protocol to help manage these kids effectively. How close are we to actually such a protocol?
So in fall of 2017, we had a conference specifically on unilateral hearing loss in children. And it was a great conference. We had many wonderful speakers, and we learned all about the latest results in research in that area, as well as clinical practice. Following that conference, immediately following the next day, there was a group of experts who came together to talk about what do we know and what do we still need to learn. And out of the meeting that we had together, we produced a guideline for clinicians, not a protocol, but a guideline that put together and summarized the best of practice as we know it today, recognizing that there are some limitations to what we know. But it would help us to provide some guidance for clinicians who want to do the best for these children with unilateral hearing loss.
Anne-Marie, what are the key points or key messages that audiologists will find from this consensus paper?
We started with some of the basic management approaches that audiologists have for children who have hearing loss in general, bilateral hearing loss, because we wanted to emphasize that these children, even though they just have hearing loss in one ear, it's still important to manage all of the various aspects of their care, just like it was a child with bilateral hearing loss, because sometimes in the literature we have seen some concerns that sometimes people don't take it as seriously when there's just hearing loss in one ear as opposed to when there's hearing loss in two. So we started out to emphasize that one point. And then in addition, what we do is encourage audiologic monitoring, because we know that children with unilateral hearing loss, a certain percentage of those losses are going to progress to the opposite ear. So many of these children will end up with bilateral hearing loss. Part of that is linked to the etiology of the loss, and as a result, we recommend, of course, close medical management as well. Some of that is the result of inner ear malformations, things like enlarged vestibular aqueduct, and we have seen that even in children who have EVA in one ear, sometimes the opposite ear also demonstrates hearing loss. So we don't really understand that mechanism, but we know that it's important for them to be managed appropriately as a result. We know that prevalence increases throughout the lifetime, from infancy into adolescence. And so it's very important to monitor the hearing of these children closely to see, are some of these, again, going into bilateral, or is it becoming more severe? So it's important to continue to monitor that. We are obviously concerned about binaural function in these children. Binaural function is going to be impaired in a child who has hearing loss in one ear, and those things include like localization. It's important for us to talk to parents about how localization can be a safety issue for some of these children. We're teaching young children how to cross the street, and of course we use two ears to know if a car is coming from either direction. So we train parents, we talk with parents about how to be sure their children can remain safe. And other binaural functions include, one of the more important ones is speech perception and noise ability. It takes two ears for us to be able to pick out the sound or the voice or the signal of interest we want to hear out of all the other background noise. And so when we lose some function in one ear, we lose some of that ability. And it is that loss of speech perception in the presence of background noise that concerns us maybe the most in terms of how these children are going to function in an academic environment, for example, where they're having to listen in the presence of a noisy classroom setting and they have to hear instructions, they're learning new language and new vocabulary.
Anne Marie, as a group, did you consider other technology supports?
Oh, yes. We spent a lot of time on talking about technology because there's so many different options. And I think because we have so many options, it becomes confusing for audiologists. Which group of children with unilateral hearing loss should use which type of technology? So as you know, some people are recommending cochlear implants for children who have profound hearing loss. Some individuals are recommending hearing aids for aidable hearing loss in one ear. Some people are recommending the use of remote microphone systems in order to help with that problem of the inability to hear speech in the presence of background noise. Those have traditionally been used in school settings for children with hearing loss, and we find that they're also very effective for children with unilateral hearing loss. As one way of trying to sort through all of those different options for the different types of unilateral hearing loss, we have suggested in this position statement or in this guideline that individual audiologists can use functional auditory assessments so that they can individualize their recommendations based on the problems reported by either the child, him or herself, or by the child's teacher, or by the child's parents. And so by documenting what difficulties the child is having, we are now able to personalize what type of technology might work best for that child.
So how does someone get access to a copy of this consensus guidelines?
So these guidelines were published in the International Journal of Audiology, and it was published open access, which means that anyone can go in and download a copy of this.
Fantastic.
And as well, Phonak is in the process of translating this document into multiple languages, and these should be available on the Phonak website towards the end of 2019.
Anne Marie, are there key areas of interest in unilateral hearing loss where you think further research is needed?
Oh, that's another good question. Thank you, Angela. We spend a lot of time as a consensus group talking about research needs, and also dove in a little bit in terms of limitations that prior research created for us. So there's a nice section in this document that talks about how we need larger data sets, and that can be accomplished via multi-site collaborations. Could also be just via the use of big data, so that we can really increase our numbers. The studies that we have done thus far have just been very small, and it's a good start. It helped us start to realize that there are problems that these children are experiencing, but I don't think we're going to really make it to the solutions for how we are best going to assist these children if we don't look at much larger groups. So that's one of the things we need to do. The other thing we need to do is start to stratify this population. So a lot of the studies in the past, including some of my own, have included minimal bilateral hearing loss cases in with unilateral, and it's just mixing, apples and oranges together. So we need to look strictly at children who have unilateral hearing loss. We need to stratify again relative to the degree of hearing loss within those groups. So whether they have usable hearing in that ear or not, what the degree of hearing loss is. And we need to look specifically at individual interventions, technologies that might be most effective according to those stratifications.
Thanks so much, Professor Tharpe, for joining us today. It's been a real honour to have you here with us to talk a little bit more about unilateral hearing loss.
Thank you, Angela. I had a great time.
And for anyone who would like to have a copy of the latest consensus paper, please visit phonakpro.com to get a copy.